Spending some time with our friend, Dr. Dennis Norem from Mercy Health, who has been with us since the beginning of this pandemic, kicking things around, and he's back with us once again this morning, and we're grateful for him carving time out of his schedule. Dr. Norem, good morning to you.
Good morning to you guys.
How's everything going with you this morning?
Oh, it's going well. I hear you're having a warm-up spell there in good old Rockford.
Yeah, you're enjoying the temperate climes of Arizona right now?
Yeah, it only hit 80 yesterday.
Oh, you all right?
It was tough to take.
Okay. I bet it was. Just go outside and go, oh, man, it's 80.
Did you take any long pants with you, or is it all shorts out there right now?
Well, it does get down to the mid-40s at night.
Okay.
So if you're going to be out at night, you probably need some long pants. But no, shorts do just fine.
Okay.
All right. Yeah, see, we should be out there. Catchers and pitchers are reporting. Mm-hmm. We should be out there as well. Good. But we have Dr. Norem doing it for us. That's going to have to do. All right. One of the things people are buzzing about, Dr. Norem, is, of course, another bit of wisdom or whatever from Dr. Anthony Fauci. We may be wearing masks into 2022, he says.
Yes, I saw that, and I suspect he is correct. Even though we would hopefully have everybody who want to be immunized by the end of this year. That still isn't going to stop us necessarily from having to wear a mask. As we've discussed in the past, just because we've immunized and we don't get ill doesn't mean we may not transmit the illness. The virus may still be active in our nasopharynx, and we may be able to pass that on. So the PPE thing is probably something we're going to have to continue to do through next year.
Now, it would appear that we're probably never going to achieve 100% vaccination rate, 100% compliance, 100% of people wanting to get on board. What do you think as a number is going to be best case scenario?
Well, I would hope we could get into the 80, 85%. If we do that, then as people have discussed, we think that the coronavirus will become, again, somewhat like the flu. It will be around. It'll have little outbreaks here and there. We'll probably have subsequent immunizations as the vaccine will have to be slightly modified. But if we can get to that point, we can control it much, better than the fact that we have very little control of it now.
You mentioned when you were talking about wearing masks into 2022. One of the reasons is we're not quite sure if you can still pass along, if you're personally immune. And I get that. This is all new. We don't know. How long will it take us to confidently figure out if you can still pass it? If you've been gotten the shot or have had COVID in the past?
Well, unfortunately, we don't have any studies in the offing to really look at that particular issue. I think I mentioned several weeks ago that there was a plan to do a major study sponsored by NIH and several institutions, and they scrapped it because the goal now is to get everybody immunized. So we'll get some information, I think, indirectly from just monitoring people. But until we actually do some well-controlled studies, we just won't really know.
You know, Dr. Norem, this jumped out at me over the weekend. I was reading this piece on this expert at Johns Hopkins professor named Marty Makary teaches at the University School of Medicine and Bloomberg School of Public Health. He says the coronavirus could be mostly gone by April. He's got an op-ed piece in the Wall Street Journal that came out on Friday. Says that daily infections have declined by 77% since January. And quoting him here, he says, there's reason to think the country is racing toward an extremely low level of infection as more people have been infected, most of whom have mild or no symptoms. There are fewer Americans left to be infected. At the current trajectory, I expect COVID will be mostly gone by April, allowing Americans to begin to resume a normal life.
I think that's a wonderful, optimistic view. That would be great. I don't know that takes into the fact that we're dealing with these mutant variants that may not be affected quite as easily by the vaccine and spread more easily. So there's there's the concern that we may actually have another wave as opposed to the fact that it's going to disappear. I mean, I hope he's right, and there is some evidence that we're heading that direction. Obviously, everybody's seen the incidents falling dramatically. We're down to numbers I think we had at the end of September, which is really great news. However, we just don't know.
Talk about those mutant variants. We had the big one, the UK one that popped up, I think, in Carroll County around here. What's the latest on some of these variants going around?
Well, I think the UK one is the one that's becoming the most prevalent across the country because it is more infective. It may not be quite as easily controlled with the vaccine, although there's pretty good evidence the vaccine works fairly well against it. The concern, I think, is that South African variant, which doesn't seem to be it seems to be more aggressive in terms of the vaccine. The vaccine doesn't work quite as well against that, and there's concern that one might give us a little more trouble. But again, it's time will tell. We just can't predict what the virus is going to do.
When you say things like the vaccine doesn't work quite as well, what does that mean? Does that mean the vaccine eludes or the coronavirus variant eludes the vaccine, or it's just not as powerful? What does that mean? Doesn't work as well?
I think Fauci explained it by saying that the body with the vaccine produces a titer, which is a level of antibody response, and you need a certain level of antibody response to fight off a virus or bacteria, whatever a fungus, whatever the pathogen that's affecting your body. What they found is we get a very good response with these vaccines against the version that we are dealing with mostly at a very high level. So we get antibody levels that are multiple times higher than what we actually need to fight off the virus. With the mutant variant, that level becomes much higher that you need to kill the virus. So what Fauci has said, and what I understand, is even with the South African version, it looks like we developed probably adequate antibody levels to affect the virus, but those levels of antibody have to be much higher against that virus versus the one that we're already dealing with. There's concern that if that changes slightly, that the levels won't be adequate to fight off that virus.
Okay, so once again, one of those, we just don't know going forward because all of these variables are being thrown at us, including another one here from Pfizer, which actually seems like it might help things. Pfizer has submitted data to potentially ease storage requirements for its vaccine. They said their vaccine has demonstrated stability when stored at minus 25 degrees Celsius to minus 15 degrees Celsius, which is commonly found in pharmaceutical freezers and refrigerators. They submitted data to the FDA to support a proposed update to prescribing information which would allow the vials to be stored at those temperatures for up to 2 weeks as an alternative or complement to using an ultra-low temperature freezer. They're saying that this might give other places an added benefit of making it easier for them to store when they get more supplies of it.
Yeah, again, that's very good news that the FDA will probably approve that alteration in the way they store the virus, which would make it easier to store and distribute, especially, in rural areas of the country and obviously other countries as this virus gets rolled out. You might find this interesting. I have a sister-in-law that lives in near Amsterdam in Holland, and they've been told that they're not going to probably get any vaccination until sometime in the summer. They have nothing in the offing. And I find that very disturbing that there are many countries, westernized countries, that are way behind the curve on getting vaccine.
Why are they not doing the vaccine?
Right.
They can't get it, or they just don't think the time is right?
Apparently, it's just a matter of poor planning. They're a European Union country, and I think overall the European Union is behind the curve. Now, obviously, countries like Britain have started to vaccinate, and I think France and Germany and some of them. But the number of vaccines available to these countries is relatively small compared to their population. And I don't completely understand why that happened, but apparently they just didn't really get on board very early in terms of trying to get vaccine and committing to buy the vaccine.
Wow. I see where I'm looking at some of the latest COVID news saying Russia's vaccination plan, after getting off to a remarkably, stunningly slow start, is finally starting to pick up some steam. But as you mentioned, that's not the same. It's not reflecting on Western Europe quite as well.
I know, and the concern about the Russian vaccine is it was never approved by the World Health Organization, and there's some concern about how effective it actually is. So that remains to be seen.
Yeah, for Britain, they say all adults will get their first shot by July 31st. That is the deadline they have set for themselves.
And that's, I think, a pretty good a rollout there in Britain if they can get the first shot by July 1st. I think that's fairly impressive.
One of the buzzwords being thrown around, it has for a long time, but was herd immunity, and I think a lot of people that use that don't understand. I've heard, we're going to get herd immunity by April. Some say, we're going to get herd immunity until 2025. Where does the science community fit or fall on when herd immunity can be effective for us against coronavirus?
I think the last thing I've seen, and I think Fauci has mentioned this a couple of times, he thinks we probably need to get to 75-80% of people vaccinated. Then we probably have a reasonably good chance at herd immunity, assuming that some mutant variant doesn't pop up that is resistant to the vaccine.
Yeah, because if something like that happens, that puts us back kind of to square one, doesn't it?
Well, not exactly. With the messenger RNA vaccines, the Pfizer and the Moderna, they are already working, as you've probably seen, on a booster shot that is specifically tailored to some of the mutants. And the ability to roll that out is fairly quick. They can do that over a period of several months. So we probably are not going to be in a situation where we're going to be back to square one. It might be a setback, but we could probably roll out a booster shot within a reasonable period of time so that doesn't get too far ahead of us.
One of the questions I've heard people asking about whether or not to get the vaccine are people that did get affected or infected with COVID-19 earlier in the year. If you had COVID-19 early in the year, still a good idea to get vaccinated right now? Maybe wait a couple months? What's the deal with that?
I think we're still looking at 90 days, but as kind of CDC guideline, you wait 90 days after your infection and you should still get the vaccine. There's good evidence now that it looks like immunity is good through 6 months for people that have had COVID. So that's encouraging also. But yes, people should still get the vaccine.
Yeah, and speaking of encouraging, just one more note on this when I'm looking at a couple of things. Texas coronavirus hospitalizations, lowest level since November. Wisconsin listed no virus deaths for the first time since September. So we're seeing different spots that had been looked at as being hot spots at really rolling it back.
Yeah, absolutely. My daughter works at Tucson Medical Center here, and they post their hospitalization rates. And they peaked, 2 months ago, they peaked at about 150 COVID patients in their hospital. And they're down to, I think, the mid-20s now, which is where they were at, again, back in November, October area. So I think all across the country we're seeing this dramatic decrease in hospitalizations and COVID deaths.
I saw a list.
Unfortunately, we still I think we're hitting that milestone of 500,000, which is telling us how dramatic this pandemic has been.
Right.
One of the lists I saw out there was percentage of vaccine doses actually administered state by state. In Illinois was towards the bottom of that list. I think they ranked 37th or 38th, like that. Wisconsin was doing great. I think they were in the top 15. Has anything changed the last couple of weeks about the Illinois-specific vaccine rollout that is getting more of these shots that are available actually in people's arms?
I don't think we've made too big a change. I know there's a lot of push to get them out, and unfortunately, Winnebago County had a little problem, I guess, over the last week or so in terms of their doses. For some reason, not getting to us, something having to do with not being ordered, and I don't know if that's been resolved. But yeah, certainly other states have done better than we have. Part of the problem, I guess, was just the planning kind of fell through. We originally were going to use an outside vendor through the state. They scrapped that and kind of tried to do it on their own, and it's not rolled out nearly as well as it should have been.
For forgetting to order some vaccine, that's not a good look.
No.
There's something we're supposed to do today, guys.
Yeah, but at least, it to their credit, got out in front of it and said, we forgot.
That's all right.
I mean, not somebody else's fault, not trying to shovel the blame, not saying winter storm, not going with your standard chest on, hey, look, we spaced it.
Right.
And at the same time, you've got the top doctor with the Illinois Department of Public Health commenting over the weekend that, vaccine, it's going to take months for it to meet the demand here in the state of Illinois. More than 2.1 million vaccine doses have been administered here in Illinois. State health officials on Sunday said that. So, but it's going to be slow. Availability still months away.
Yes, unfortunate. But again, maybe by summer we can get enough people vaccinated to get close enough to that herd immunity that we'll see things really become less of a problem. But that doesn't mean we're not going to still be wearing masks and social distancing, and we're going to have to be careful.
All right. Well, Dr. Norem, as always, we appreciate you. First off, struggling through the rough temperatures of nearly 80 to be on with us this morning. We don't ask that kind of thing out of everybody. We appreciate you doing it. And we appreciate the expertise. We'll look forward to getting together with you next week.
Sounds good, guys.